Approving a COVID-19 vaccine is only half the battle. Health experts say the government needs to determine how to distribute it and who gets it first. Sarah Dalloff explains.
The race is on to develop a coronavirus vaccine and distribute it ethically and efficiently. In Massachusetts, the bulk of Acme Dry Ice's business is from vaccine manufacturers.
We've gotten calls as far as California, Seattle, Chicago, Texas.
Several of the leading vaccine contenders must be stored at sub-zero temperatures. UPS building freezer farms. Hospitals and states asked to plan now.
This is definitely probably the most daunting task that we've had to undertake.
The first doses will likely be limited, possibly covering as little as 5% of the country's population.
The first round or two or three of vaccination won't be sufficient to achieve that level of population immunity.
A CDC advisory group is recommending those initial doses go to healthcare workers and high-risk groups, expanding to others as more doses are manufactured and possibly more vaccines approved.
There are different platforms to deliver the same technology, essentially. So I fully agree that if a vaccine works, we'll likely have multiple vaccines.
All Americans likely will have access to these new weapons in the fight against COVID within a year to a year and a half of their approval. Each phase in the process complex and critical.
Another challenge for health experts, convincing approved vaccines are safe and effective. A recent Pew study finding about 50% of Americans say they'd probably or definitely would get a COVID vaccine. That's down around 20% from May.